Fox News reporter Katie Weiss has been doing some digging for those answers.
And she joins us live from the Mobile County Health Department, where the woman first sought treatment for her symptoms. Katie, what can you tell us?
Well, Bob and Lenise, just as any sick person would, the woman actually took herself to the Mobile County Health Department to go to the doctor's office to get checked out. Now, she was ultimately taken to USA Medical Center for treatment, as you mentioned, but this brings up a few questions that we wanted to ask. I mean, think about how many people she could have come into contact with while she was sitting in the waiting room or signing in at the doctor's office. Health officials actually addressed that issue today at a press conference at the USA Medical Center, and they said that they need to warn doctors' offices like the Mobile County Health Department to take extra precaution to prevent the spread of the virus.
Every hospital in the country and doctors' offices, urgent care clinics, these are all portals of entries for these types of patients, and they're all going to have to be acutely aware of what's going on and be prepared and take the appropriate precautions.
After yesterday's incident, we're looking further into the timeline of events. The woman originally sought treatment at the Mobile County Health Department, where she had been a patient before. She came in around 2 p.m. She was registered and taken to a room to be seen by a doctor. In that room, health officials who saw the patient ran into issues with translation, as the woman was speaking Swahili. Mobile County Health Department officials say her story seemed to change a few times in regards to the amount of exposure she had had with relatives from Africa.
The story got a little confusing with the translation because we had a language barrier.
By 4:30 p.m., the decision was finally made that she could be at risk for Ebola, based on the vague symptoms she was showing and the exposure to African relatives she had encountered.
And everybody is very sensitive to the Ebola virus and the foreign nationality, and then people were very concerned, and then there were precautions were taken with the people who actually went in the exam room with her, and as was described, she did not have fever, but there were just pieces of the puzzle that didn't fit together, that everybody wanted to err on being cautious.
But it wasn't until after 6 p.m. that she was taken to USA Medical Center. Dr. Eichold says that's because it was not an emergency.
This was not an emergency transport situation. The reason Mobile Fire and Rescue was actually called was because we were concerned, was she going to actually be reliable in coming to get the specialty evaluation.
She was at the health department for a little more than 3 hours. We asked folks who also visited the health department if they were worried at all about a patient possibly spreading the virus to others before they are diagnosed.
So this is going to be a serious issue.
I didn't have any concerns going in and then being taken care of and coming out, and you know, if I may have contracted something, it's just one of those things. All I can do is pray and go on.
Now, once she did get to USA Medical Center, it was determined that she did not have Ebola. Bob, Lenise?
All right, Katie, so if she does not have Ebola, what does she have? Do you know?
Well, the health officials wouldn't really release too much about her condition today because of HIPAA laws, but they did want to mention that she was suffering from some symptoms of a chronic condition that she's had over the last several years, and that she is currently getting treatment.
Okay, Katie, you mentioned that hospitals and physicians' offices around the country can serve as actually portals for the entry of the spread of the virus. Have health officials offered any advice on how to take extra precautions?
Well, they really wanted to emphasize today at the press conference that it's important to just be very aware of the fact that hospitals and doctors' offices can serve as a portal of entry for the Ebola virus, and it's important for folks to really be conscientious about active hand washing, covering your mouth when you cough with your elbow instead of your hands, things of that nature, and especially disinfecting public areas. Back to you.
All right.